into that. But as many of you know, I prefer to answer your questions too. So easiest way to do that is the chat function. And Mickey, if you would just cut me off if there's a question in chat, that would be great, because it's hard to do all of that at once. And obviously I had link issues today, so it's a tech day for me. So how are we doing in the state of Wisconsin when it comes to COVID-19? I think, you know, it's pretty obvious we're not doing great right now when you read the lay press, and especially over the last 4 or 5 days. You can see that our percent positivity, and why are we following this number? It's a number given to us by the World Health Organization. It's given to us by the CDC. It's a benchmark that's been used to, number one, make sure you're adequately testing a community, and number two, to make sure your community's rate of spread or the burden of COVID-19 is under control, where you could start to phase it in. 5% was the magic number given to us from those two scientific bodies. And as you can see here, our trend line is significantly above that and continuing to go up well over 10% at some points. So right now in the state of Wisconsin, not in a good place. Hopefully this will continue to improve. At one point a week ago, we were angling in the other direction. So it can change. You just need a lot more focus on getting the right people tested, getting them tested, getting those results, and then obviously doing all the other mitigation things we can do between masking and physically distancing. So that's how we're doing right now in the state. The hospitals are doing pretty good. We've got capacity here locally in Brown County, most definitely. Last count this morning, I think ballpark around 22 patients, hit a high of about 32 last week. So that's in a good place. As you all know, that can change overnight, because really the people who get admitted today are the people who have been positive for a while at home. So when we start to see these high percent positivities, we kind of wait for that wave of admissions to come, days after. So a little concerned about that, but as it stands today in the state, we have the capacity to take care of people. This just a little purveyor data on its own. This is our testing volumes and our percent positivity of our eastern Wisconsin testing sites. That's basically from Oconto to Sheboygan, who we call the purveyor East Coast, because we're on the west side of the state as well. And the green bar is our percent positivity. So, locally here, obviously angling up in that 7% range. Less than 5 is our goal. And then we actually put our total test out there. You can see we've ramped up testing pretty significantly over this time period. And please understand, this is back to May. It's not a 14-day shoot. This is really just where we've been around our testing journey. You'll see that testing has fallen off August 2nd, August 9th versus the weeks of July 19th and 26th. That has more to do with the state and our ability to get the equipment we need to test. We actually have the lanes open to do that. It's just getting the testing kits from the state of Wisconsin. So I was going to walk through a little bit of testing and some scenarios for employers, because I think a lot of people, and some of you know I did this for Purveyor earlier today, so it's a little bit of a repeat, but many people are worried about schools and what happens when school starts. Not as much the school focus of it, but as an employer, I bet you have people that are working for you or you yourself have school-age children. So kind of wanted to walk through some of the scenarios that you could have to deal with as an employer about what to do with an employee that has to be out of work based on exposure. So as we go through this, it's important to know that if you have a positive test, you're 10 days out. 10 days is the minimum you're going to go up. It could be longer. It really depends on your last 24 hours. If you have symptoms and they're completely resolved in the last 24 hours without medications to resolve them, such as fever-reducing medications, you're done. 10 days, you're out of isolation. Isolation means that you're not just quarantining, you're really keeping yourself away from other people. If you live in a house full of people, you're staying in your room, staying in the basement type of situation. That's isolation. That's if you're positive. And once again, symptoms have to improve 10 days. And then you're good now per the CDC for 3 months, 90 days. You don't have to be retested. You could be tested and be positive, but it doesn't matter. 90 days, you're not considered infectious or that you could be reinfected. Why 90 days? Well, that's about how long we've had to study this virus, if you think about it. We got to know it in early March, late February. You take getting exposed people, take a retrospective look, see how they're doing now. That's why 90 days. So we don't know if immunity could be longer than 90 days, but we have enough confidence through the CDC's research and the articles we've read to say 90 days you're good. So it could get longer over time, and we can only knock on wood. It's a negative test. If you have symptoms and you get tested and you're negative, and your symptoms go away without fever-reducing medications within a few days, you can get back to work. But if your symptoms are not going away, you do need a further workup and possibly retesting. So, you know, this is where it's going to get pretty tricky. It's understanding what a contact or a close contact is. So these are the people that I did not know that the person I was exposed to had COVID-19. What's the definition of an exposure? And do I have to quarantine or not? This is a workplace setting nightmare. It's going to happen to all of us. It's important to kind of walk it through. There are 5 definitions of an exposure, only 5. And a lot of people make up other stuff, but there are 5 CDC definitions of exposure. First one, I think we pretty much know, 15 minutes or longer, less than 6 feet with somebody, mask or not, is considered an exposure. So I was less than 6 feet. I was in a conference room, but we were less than 6 feet because we sat next to each other, or both masked. You're still a significant exposure. Direct physical contact, shaking hands, hugging, kissing, other physical contact, definitely, don't matter how long it lasted for, it's significant. Shared eating or drinking utensils, and I extend this to sharing food, taking a bite out of an apple and handing it over to hopefully somebody you know. They're also taking a bite out of it, you're out. Doesn't matter how long or what the exposure was. You provided care for somebody who is homesick with COVID-19. You're a significant exposure. This is where the school stuff starts to come in, parent taking care of a child, and they sneezed, coughed, or I always like this line from the CDC, somehow got respiratory droplets on you. Creates a lot of creativity in your mind, doesn't it? But that's from the CDC, and obviously, no matter how long the exposure, how close it was, you're out. It's 14 days. So once again, if you have a positive test, it's 10 days, no matter what scenario we walk through. But negative testing can have some different criteria to it. So you're exposed to somebody that has COVID-19. By exposed, whenever I say exposed, it's one of those 5 categories, and you're not living in that house. Coworker. You stay home for 14 days after your last close contact with that person. Say you're in the house with that person, but that person is isolated in a separate bedroom, different bathroom, not sharing any common spaces. Your 14 days starts when your last contact with that person in the house was. Say you cannot. Say you're caring for a child. You cannot isolate. You don't have that physical ability in your home to do that. You live in a studio or a 1-bedroom apartment and it's just impossible. Your 14 days start when the other person's 10 days end. So in other words, that person's still infectious for those 10 days. So your 14 days don't start till that 10th day. So you could be looking at 24 or more days in quarantine. So I'll walk you through some scenarios right now. Close contact with someone who has COVID-19 and no further contact. So an example, and I'm going to use school examples, not because this can't apply to everything else. It can apply to everything else, because schools are about to start and it's going to affect all of us as employers. I thought I would stick with school examples. A teacher and had close contact with a friend who was tested positive for COVID-19 and not going to have any other further contact, you're out for 14 days when that contact started. I'm a teacher and had close contact with a student. Student's going to be at home. I have 14 days of quarantine from the last day I saw that student. So day 0 and then add your 14 days. I am quarantined because of close contact. Can my child attend school? So yeah, that secondary person, if that person did not have your husband, your child, did not have contact with the positive person, you are not quarantined. You can go to school, you can go to work. Great example here for an employer. An employee calls, my wife is, or my husband is quarantined for 14 days because they were exposed to somebody at work. I now have to stay home for 14 days. That is wrong. That person can come to work. If that person's spouse or the person they live with was the positive person, then they have to be quarantined for 14 days. So these are HR nightmares, and we can give you the calendars, but it's important to understand when you're having to answer those questions or you're getting those calls. And Mickey, once again, if there's questions in chat, I don't have chat open, so I can see the slides. So let me know if something comes up. Oops, we skipped scenario 2, a really important scenario. So give me a second here. So I had close contact with someone who has COVID-19, live with the person, but can avoid further contact. So once again, I tested positive for COVID-19. Can my child attend school? No, because they live with you. If you can completely isolate from that person, then that last day of contact is when the 14 days start. So if you can isolate away from your child, that child can go to school in 14 days. If you can't, then it's when you're done with your 10 days, that child's 14 days start. Scenario 3, I'm a teacher or under quarantine and had additional close contact with someone who has COVID-19. In other words, I'm already in quarantine and boom, another family member turns positive or another contact turns positive. Your 14 days start again. So every time you're exposed to somebody that's a newly diagnosed positive, it's that day of exposure, to that last day of exposure to them when they turn positive, that your 14 days start. So I'm in quarantine on day 5, another kid comes home, that person's positive, now I gotta start again. Why? Because of that, once again, incubation time and who could you have been exposed to over that time. Scenario 4, I live with someone who has got COVID-19 and cannot avoid continued close contact. This is once again, I'm a teacher and the child of the teacher is positive. They need to provide sick care, so this is no different. I'm a machinist and my child needs me at home because daycare won't take them. There's nobody else that can take care of my child because the grandparents were even only exposed to. My 14 days start after the child is recovered. Recovery would be 10 days. This is 24 days out of work. That's, really important to understand that that 24 days is really dependent on that 10 days the child is feeling better. In the last 24 hours, no fever or significant symptoms. So this is kind of that nightmare, working situation where somebody's out for 24 days. Scenario 5, this one's going to come up a lot. It's probably the most commonly asked question. It's the one where somebody doesn't want to come to work, and you're going to get this a lot. So I wanted to walk you through that because I think we also have that set of employees, if you know what I mean, too. So I found out my child's teacher has a household contact with COVID-19. Does my student need to be tested or quarantined? So this is that exposure to an exposure. And no, really only the people who have been exposed to the positive fall into quarantine, not the people who have been exposed to the people who have been exposed. And that's really important. So the teacher falls under quarantine guidelines. The child does not need to be tested or quarantined. So teachers quarantined at home because that person's spouse is positive. Nothing has to be done with the classroom. You can extrapolate that to any working environment that you would like. This is something that I get asked, and employers call us on every day. Can I test myself out of quarantine? No. You can get negative tests for 14 days straight, still not out of quarantine. The only reason to get tested when you're in quarantine is if you're symptomatic, or if we want to find out, which is really important, who else you might have exposed because you're positive. If you're negative, we don't do exposure tracking. If you're positive, then that exposure tracking expands. We usually say about 4 to 5 days after your exposure, you should get tested. If you're asymptomatic, right away if you're symptomatic. But quarantine periods are not adjusted if you have a negative test result. There are some minor exceptions here for critical workers, specifically in healthcare or in certain circumstances where that person is critical to the infrastructure of what we do, or somebody else's life might be at risk, that we could possibly allow that person to end their 14 days early with the negative test, given that they're asymptomatic completely. So we get this a lot. People are trying to test themselves out of quarantine. I'm fine. I got tested. I'm negative. I can go back to work. No, you can't. 14 days is 14 days. You cannot come back to work. So I'm going to take a pause because those scenarios can get kind of interesting for those of us that have employees. I have well over 2,000. So trust me, this is a daily thing where we've got to walk through it. So I want to be able to make sure I'm answering your questions on it. Or any other COVID questions for the day?
I didn't have any come through publicly, but I do have one that asked, and I'm not sure if you know this, Dr. Rai, but do you know if Wisconsin DHS is providing any guidelines for reopening schools or Brown County? I know other counties have begun providing that info.
So really good and timely question. So I think people are looking for some sort of gating criteria. We hit this number, we can go to school, right? And for Brown County, you can extrapolate it from some raw data they have, but they haven't updated it in a couple of days. And some of the raw data has some really odd outliers that we have questions in the DHS about. So I would say the data is iffy in the raw format. We can plot that out for you, and I have plots out for you. It doesn't make Brown County look any better than what I've shown you. DHS is supposed to, this week, come out with county-specific gating criteria for schools, such as percent positivity and a couple other criteria. Why they're doing this now 2 weeks before and not a month ago, that's why I'm not in public service. I don't get it. But hopefully we'll get something this week. And we've been working with the school districts and getting them the data that we have so they can at least make some decisions. And by we pull together our colleagues at Bell and Aurora and us, we pull together our data and we give it to our public health officials and the schools so they at least know that. But that's not all the testing done in Brown County. That's not the prison. That's not the nursing homes that we're not involved with that kind of go directly to the state. The state has all of that data, just getting it. And like I said, some of it's been, I think our actuary actually described it as wonky. So that's the technical term. So we're still trying to sort through that with DHS. A little disappointing that that's not better right now, given some of the critical decisions that are being made based off of it.
Thank you.
Get a lot of questions lately about masking. So I want to cover that real quick. Masking and the type of masks. So some articles came out last week, specifically one study, a lot of articles quoting one study, I should say. And really talking about the neck gaiter bandana maybe not being the best device. And I would agree, anything that can't seal the chin right away is not a great masking device. I'll put mine on for you here today to show you why. And you want to make sure that, things are not escaping. So things are not escaping through the nose. This one has a nasal bridge to it because I wear glasses. And you want to make sure down below the chin that it's touching that skin. In other words, you have the best connection to prevent things from leaking out below. That study did make some comments that actually gaiters and bandanas can make things worse. Pretty small study. Would love to see more of that done of the why the worst. But what they're saying is because of the material, breaking apart the droplets and then letting them escape, you're starting to see a lot more spread. So they could be, number one, they're definitely not as good as a mask. And there is one article that says it could be worse. I think you probably need a little bit more research. Either way, probably not the most recommended thing. Just saw a question come through. I can't bring up the chat, so.
Okay. Please clarify the earlier remarks about 90 days if you previously tested positive. Did you state you do not need to be tested again or quarantined within 90 days, even if exposed? Thanks.
Yes. Yep, Pete, I did. That actually came up from the CDC. I don't know the exact Friday. I love how they put this stuff on Friday afternoons, by the way. Why not Monday? So Friday afternoon, CDC came out with that guidance that 90 days, no need to retest. Now, there's some certain circumstances. In other words, you're going to be physician-driven. You get to be severely immunocompromised. We think that 90 days may be a little wrong. That's somebody who's under chemo for cancer. We're talking the types of situations that's going to be physician-driven. But for the general guidance, 90 days, don't retest. You could be positive and it means nothing. Exposures mean nothing. Got a question. If you're traveling out of the country and the country is requiring you to have a negative COVID-19 to enter their country, can you get a test without symptoms? They're being told on the phone by Prevea that you have to have symptoms to get a test. Is that true? So you have to have symptoms or exposure to be able to get tested through the state. In other words, Prevea does its testing through the state of Wisconsin, getting that. We have a second avenue, and that button should be live today, where this is getting to be a common question, where we can bill your insurance, use it basically submit that differently and then be able to provide you that test. But if you wanted the state testing, which is about 98% of what we do, the state does have restrictions on that. But this is coming up. I need a negative test before I go to college. And in those types of circumstances, we should have that live and going for you here in the next 24 to 48 hours. But you can also call us and we can walk through that. We had to make that change based on a state request. Hopefully those scenarios help you walk through. I mean, they're really, as an employer, these are the types of things that you're going to see more often where public health has told somebody to do something, and if you wanted to clarify what needs to be done, you wanted to make sure you had that information as well. Also on the horizon, I get a lot of questions about the immunizations. We should know more in about 60 days is the 90 days of the experiments on 30,000 people. And then it takes some time to get the data, then for that to be written up, start to research it. So end of this calendar year, hopefully we'll have an answer, and then hopefully they'll be able to start that production. It's actually interesting. 2 of the companies have actually started production without FDA approval, so hopefully they're right. The neat way of how these vaccines are being designed versus our traditional ways is that they can actually ramp up production pretty quickly. And then we'll have to go through triage trees of, you know, what order do people get immunized in, and then be able to deliver that to the community. To confirm, if a person has a negative test, is asymptomatic, they still have to quarantine for 40 days. Yes, Andrea, you cannot test yourself out of quarantine. And trust me, it's the most common question, and we get a lot of questions on that. So, you know, like I said, the rarest exceptions are in healthcare and in, you know, critical type situations. But in general, for 99% of the population, you cannot test your way out of quarantine. Why do we test you then if you're asymptomatic? Once again, waiting about 4 days to see if you are positive. Then we need a contract to trace more people around you and isolate them and get them, quarantine them and get them tested. And you now go to isolation. So say it's day 2 and you got tested. This is going to kind of make you scratch your head. I'm on a 14-day quarantine, but I just found out in my second day, I went and got tested right away, that I'm also positive but asymptomatic. Guess what? You're now 10 days from the time of that test. You just shaved a day or 2 off your quarantine. So probably, Andrea, the only way you can shorten that up is if you actually turn out positive. Do you know what our schools are doing differently to prevent what is happening in other states, i.e. Georgia? Bill, I would say number one, our superintendents, their staff, their teachers, their janitorial staff, their school boards have done an amazing job. Every school has different resources. Every school has different spacing. Each one has their own plan. I would say the ones that we worked with have done an amazing job. What's happening in other states in Georgia? To be honest with you, they probably opened up when they shouldn't have, and hopefully we have data that shows us when we should and shouldn't open. That's the biggest difference, is everything that the school districts are doing are mitigating measures. You can't mitigate in the middle of a breakout. You're trying to mitigate to prevent, you know, massive spread, but if you already have massive spread, that's a problem. So defining that, measuring that, and making sure we're safe to open. Remember, the state was supposed to phase in. We chose not to do that due to whatever reasons you want to point it to. But the federal government, both sides of the aisle, the scientists, everybody said you should have a phase-in approach to opening. The state of Wisconsin chose not to do that. So now we have what we have in our current situation. My observation is that when outdoors, a lot of people are not wearing masks, even within 6 feet of other people. Talk to us about how much being outside reduces the spread. What is the research on this? So data shows that there's definitely a dissipation of the particles significantly. It's just all based on air exchange, and there really is nothing better than Mother Nature's HVAC system. But the CDC does not take that into account when looking at your 6 feet for isolation. So if you're asking me if you need to be quarantined, if you're less than 6 feet and you are outside and you spent more than 15 minutes with somebody, the CDC answer would be yes. if you're asking me what my risk of turning positive is, despite the CDC quarantine recommendations, which we do have to follow, it'd be significantly lower than if you were inside. So the risks go down significantly outside. They have timelines for how long the virus is able to live on surfaces. It's been all over the place. I think the most recent data is 72 hours on a variety of different surfaces, but it's important to remember that surface contact inoculation is pretty rare. The majority of people, if not say 90+%, are going to get COVID-19 because of respiratory droplets being put into the air, aerosolized into the air. Those droplets do fall. They do live on a surface for up to 72 hours. You would need to have a significant amount of that fall onto your hands and then put that into your respiratory tract. Put your hand in your nose, your mouth. Sorry for that thought, for you to be infected. So it takes a lot to get COVID-19 off of a surface. Should we stop cleaning things? No. Should we stop washing hands? Absolutely not. But the likelihood, once again, is much greater through the air than it is a surface. Best time to get flu shot this year, Abby, when we get it. So right now we're planning through all of that. It's going to be probably mid-October into November. Standard season, big push in marketing and communications and PSAs from all of us in healthcare to do it. Getting influenza and COVID at the same time is nothing I would wish on anybody, would never wish any disease on anybody, but the combination of the two for a lot of people could be lethal, and we're very worried about that. So really aggressive influenza immunization. This is where hand washing comes in, mask wearing and physical distancing all comes in again. We need to have a really low influenza season for us to be able to survive, literally survive the next 6 months. So once we know the immunization timeline, in other words, when they're going to be shipped, when they're actually going to be delivered, the amounts, we start to see communication. Our hopes is early to mid-fall, so some point in October. Other things, other topics I can cover for you, Mickey, let me know. Otherwise, once again, I'm really sorry about the technical issues that we started out with today. It was just couldn't find the link.
It's all right. Does anybody else have any questions? Can you provide us some information on what our numbers are like compared to other countries?
You know, I haven't really looked at us internationally other than, everybody's kind of doing the peak and valley. Majority of Europe, their rate of transmissions, their percent of positivities are significantly less than ours. But it really depends on what part of the United States you go to. We're definitely not as homogeneous as, say, Italy or as Germany, where they measure it as a country, not as states. Our size, our geographic breakdowns by state make it a little different to have that. So you're asking how the US is doing versus other countries? Not good. But we have certain states that do better than others, but as an aggregate, not well benchmarked against the others.
I don't see any other questions. Oh.
Get one up?
Yeah. If there is only one bathroom, multiple bedrooms in a home, is proper isolation to not have others quarantined as long as possible?
So, the issue is here the one bathroom situation. It's come up a couple times. CDC would say ideally that the isolated person is not using the same bathroom as everybody else. If you cannot manage that, but you're still trying to do isolation, try to make sure there's a good amount of time spread between people using that bathroom, like an hour or two, to let the air clear, open the windows, do things you can. But really, under the strictest of guidelines, under the CDC, true isolation would mean that you're not sharing that bathroom. Wow, this is probably getting recorded too. I see that blinking red light, and then I'm being asked, in my opinion, should Brown County Schools be doing in-person school on September 1st? really depends on the district and their plan. You know, some have the ability to space, Andrea, some have the ability to do things differently. Some, like Green Bay Public School District, just did not have the options that other districts do. So I think it's a district to district conversation. Everybody's in a different position. The rate of percent positivity worries me today. The activity and the behavior of those in Brown County worry me significantly. You know, when I hear of a wedding of 150 people where they're specifically asking people not to mask, I mean, what am I supposed to say to a situation like that when behaviors like that exist in our town and people aren't doing it, and then you at the same time want schools to open? It's a hard balance. So I would say that right now it's a district to district situation. The overall percent positivity does not look good. I hope to get to you all through DHS better Brown County data, but all the data that we have of the people we're testing don't feel good about it at all. I wish it was going in the other direction and below 5% and maintaining that. And understand, when we have our data out there, there's a lot of asymptomatic people getting tested before they get surgery done. So you took those people out, that percent positivity would even be higher. So even with us, you know, having a kind of a pool of patients that say would be surveillance testing, even with that, those numbers are still angling upwards. That's very concerning to me. So I think we have to make sure that we all have options and that we are looking at the data on a regular basis and supporting our schools in whatever decision they make and understanding they're going to have to pivot. You know, I was on a public health call with school districts today and kindergarten comes up. There's a positive kindergartner, you know that there's probably, if you're a parent or have ever been around a kindergartner, 6 feet, 15 minutes, there's no way that that's going to be regulated no matter what we do. So an entire class will be quarantined every time a child is positive in that situation. So, and that's something just we have to be prepared for. An employee comes to work with a cough and fever during the fall cold. How determine if testing is needed? If they're symptomatic, they get tested. If they're in that 11 symptoms of the CDC, they should not be coming to work. They should be tested, and they should not be coming to work after they're tested. They should be going home and waiting for those results. They can come back if 72 hours has passed and those results are negative and their symptoms are resolved. If their symptoms aren't resolving, they should be communicating with their physician. I recently wore a mask for several hours, and after I took it, I felt really unwell, lightheaded, and just tired. What advice do you have for those who have to wear a mask for a long time who normally don't? You know, number one, people feel like they're retaining carbon dioxide. You're not, especially if you're wearing a cloth mask or a surgical mask. N95s for a really long period of time. There is some evidence of that, but once again, it's still a small bump. But it's a situation of just not feeling comfortable and not feeling well. So organized, timed mask breaks. I'm going to go outside. I'm going to get some fresh air. I'm going to be more than 6 feet away from each other, and I'm going to take my mask off, and I'm going to spend 5 minutes or 15 minutes of getting some fresh air. And that's probably the best thing you can do is just give yourself some regulated breaks. There was a time in this country where we took smoke breaks, right? Well, now I'm asking the time in the country where we all go outside, spread way apart, and take a mask break. Can't wait for that analogy to come back and bite me.
Any other questions? It doesn't look like it. So Dr. Rai, I want to thank you again for giving us an update and answering our questions. You're always great with this and available to everybody. So thank you for everything that you're doing. And with that,
I did put my email address out there. If people were uncomfortable asking me about a specific situation, they can always email me directly.
Perfect. Thank you so much. Thank you all for attending, and we'll see you next time.
Sounds good. Thanks.